Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Being a ballet dancer is a very good way to start off to become a doctor, I think. I just don't happen to know any ballet dancers who are doctors, but we're very fortunate today to be able to talk with Dr. Davenport. Dr. Davenport was, I guess she was a ballet. She has no time to be a ballet dancer now. But Dr. Kathleen Davenport, is with Memorial Regional Hospital. Thank you for coming to our show.
Thank you so much for having me. I'm honored to be here.
Well, wouldn't being a ballet dancer help you in the sports arena?
Absolutely. In terms of becoming a doctor, there's so much discipline that's required for your studies, so ballet helps that. And it also helps transition to other sports and activities. And I still do ballroom dancing, which is great for people of any age to keep active and balanced. So as long as you're doing something active that you love, that's what I help encourage my patients and my friends to do.
I'm just glad you mentioned that. I have really been considering doing ballroom dancing. Is that a good move?
You would love it. It helps with balance, it's social, it's active. My husband and I do it together, but you can do it if you don't have a partner. So any kind of physical activity that you can really get into, whether you're a tennis person or a golf person, I'm a dance person, so all of those to help you keep active.
You must have loved, of course, the champions that we just saw.
Yes,
and
absolutely.
As a female, and to see what they do. Talk about sports.
Yes, oh my goodness, they were amazing. We watched all the World Cup games with my husband and I. We had so much fun watching them, and congratulations to our women's teams. They are such amazing athletes.
They are. We're very happy. And then that young woman with tennis.
Yes.
Who's from Delray. I mean, she's 14 or 15, very young, maybe 16, I'm not sure, but very young.
Yeah, we have such excellent athletes, not only in the United States, but in South Florida. We have a fantastic active culture here for people of all ages, our young professionals, our older professionals, and everyone in between. It's really an exciting place to live and to be active.
It must have been the sun that caused everybody to be so strong, huh?
Yeah, well, we have beautiful weather, even in the heat,
yeah,
it's still nice to be out and about.
So let's say that someone was playing one of the sports and they hurt themselves. Are those the kind of patients that you deal with?
Yes, I help active people keep with their energies and with their activities and keep strong. And so sometimes that's preventative, some little tweak or thing that's not going away. We can prevent any kind of larger injury, or if there is a big injury, we can work that up and get people back to their activities. And the nice thing about where I work at Memorial is that we have a multidisciplinary group. So I'm the non-surgical one in the group to try and prevent surgery. But if you need surgery, I work very closely with our surgical colleagues. And we even have sports cardiology of really keeping people active in terms of their heart and cardiology as well.
Years ago, Dr. Davenport, it was pretty much you're either a cardiovascular surgeon or you're a primary care physician. But now there are so many subspecialties, aren't there? You were just mentioning some.
Yes, we have so many subspecialties, and that can be very good because people really can focus and tune in and fine-tune your treatment. But it can also be frustrating for patients because they're not really sure what specialty to go to. So a lot of times it's nice to have a multidisciplinary center like Memorial that no matter which doctor you enter in, we all work very closely together and refer to each other or outside if we need to, just to make sure we have the right team for you.
Are you dealing more with emergency situations or with people who just have chronic pain? Is it more acute or chronic?
Both. So the nice thing is that Memorial also has an urgent care center. So if they need something to walk in same day, and we work very closely with our urgent care centers. So if they go in same day and they're like, well, you're fine, you can go home, but you really do need to see an either orthopedic or non-surgical sports medicine doctor within a couple days, we can get people in and take care of them from that standpoint. So we see both acute, mid-range, and chronic issues.
And when did you decide you wanted to be a physician? I mean, you were a ballet dancer, and were you professional and with big ballets?
No, I did not dance professionally because I knew I wanted to be a doctor from a very early age. So when I was in middle school, my grandfather's a doctor, and I always wanted to follow in his footsteps. And so I knew I wanted to be a doctor, but my path with ballet and then dancing in college helped me tailor to go into sports medicine specifically.
And let's just give me a difference in sports medicine. So if you're a primary care physician, and you can't manage the pains or aches or what's happened to your patient, you would refer them to a sports physician? Is that the way it works?
Absolutely. So some primary care doctors feel very comfortable keeping their back pains, knee pains, hip pains, and some feel that that's not really where they have focused their practice or their area of specialty, and that's where we come in to help manage those areas of pain so that your primary care doctor can focus on the bigger picture.
Right, because there's so many new methods and ways now for you to make people's pain, whether it goes away or it's less, because that's the whole new thing with robotic care and with exercise, swimming, all sorts. Tell me what your favorite, when you refer someone to a way that they should exercise, what is your favorite exercise for someone?
I love this question because ready for this answer? My answer is always that my favorite exercise is the one you're going to do. So,
that's very good.
That is always my favorite exercise. If you don't like any exercise and you just are forcing yourself to do something, then I recommend starting non-impact, like something in the pool or a bike or something like that. But truly my favorite exercise is something that you're going to do on a regular basis, keep active and keep healthy.
Yeah, that's the problem, isn't it? That everyone says you have to exercise, but then they don't know what exercise they should do or how often they should do it or how intense they should do it. So do you have a prescription? So you have a patient. Tell us how you handle this. What is your prescription?
Absolutely. I actually have a written out exercise prescription, and it goes through different areas of exercise. And sometimes I will have patients simply come in and say, how do I get started? And so sometimes we bring people in like physical therapists or personal trainers to help with that. And sometimes we do that between the doctor and the patient, depending on, many factors. And when you look at an exercise prescription, you look at different parts. So we look at our cardio part of how we address cardio exercise, balance, strength, and flexibility. And then we try to tailor each of those areas of where the patient is at and each individual person's needs.
I have read many documents about having ultimate good health. And there isn't one. Of course, I don't smoke, and all the documents say, of course, you can't smoke. But the other, and besides eating properly, exercise is on every single list.
Absolutely. When you look at so many health conditions, cancer, dementia, balance, falls, all of those things come back to having healthy habits with eating, not smoking, and exercise. Those are the top 3 things you can do to have a longer, healthier life.
And I remember years ago there was a man who had diabetes. He wasn't born with it. It was late diabetes. There's a word for that.
Type 2 diabetes.
Type 2. And he started walking, I think it was 4 miles a day, up and back on the street where we used to live. We used to watch him. He literally, after a few months, didn't have diabetes anymore. Isn't that? Now tell us why. Tell us what happens.
So what happens is when you exercise, and I also focus with my patients more on fitness rather than fatness. Muscle weighs more than fat, and so I don't pay attention as closely to a number on a scale. That's okay, but really we want to focus on fitness, so things like walking. As that happens, your body actually changes. You build more muscle and you lose fat. And then how your needs are for your body in terms of taking in food and nutrients and using them actually changes. And so things like diabetes, high blood pressure, high cholesterol, those can all get better or even go away as we move forward with our exercise regimen.
And does age make a difference? Tell us do you have people in their 90s exercising the same as people
Absolutely.
In their 70s?
Well, it's not exactly the same regimen. That's why we tailor it to each individual person. And it doesn't have to do necessarily with age, but perhaps activity level or other conditions, other medical conditions, surgery, those types of things. So I always say age is only a number, and we look at overall the body health, body composition, other things that are going on in terms of health and wellness. But I also tell my patients that you can build muscle, you can strengthen, and you can improve your heart health at any age.
Dr. Kathleen Davenport is our guest, and she's, of course, from Memorial Sports Center, Memorial Medicine Sports Center. No?
Memorial Sports Medicine
Center. And Memorial, I really have to applaud them. They have so much going on there. I mean, the one thing that I love, especially, and I know that's not in your field, but it's their wound care.
Yes.
I mean, they have the hyperbaric oxygen. Most hospitals do not do this. So it's really, Memorial is such a diverse hospital, world. The health that you have there is extraordinary. And it starts, down in Pembroke, and you have one in...
Yes.
Where are you located?
Yeah, I'm in Hollywood. Down at Memorial South is where the Sports Medicine Center is, just south of Regional, but in the same area. So it's east off 95, but down in Hollywood.
And they have one in Pembroke Pines.
Yes. And we even have one out in Miramar, so either farther south and far west, and then Pembroke Pines. And then we have one either farther out west on Flamingo Drive as well.
Right. So, but the sports medicine, is it only where you are in Hollywood?
That's our main center, but one of our sports medicine doctors also has office hours out west in the Miramar area.
Now, someone who has complaints of pain in their arm, their shoulder, their leg, would they want to see a sports medicine doctor, or do they, is this something simple, or why would they need to go to something so specialized?
Yeah, the sports medicine doctors, what we want to do is keep you doing the things you like to do and keep you active. And so I recommend, if you have an area of pain, that you do seek out a specialist, because this is what we've dedicated our lives to, is addressing many ways to treat that pain and tailoring those treatments to your individual functional needs.
And so the first thing people do when they're in pain, they start popping pills.
Right.
And we really don't want them to have to do that. And yet, probably some people may have to have some relief of pain, but I know that exercise in many instances can do what the pain pill is doing. Does it not? Can it not?
Absolutely. And so if I do prescribe medicines for my patients, which I don't for everyone, but if that is needed, I always tell them this is a short-term pain relief for the long-term pain relief with the therapy and the exercise and things like that. So popping pain pills and getting that short-term relief, that can help in the short term, but in the long term, the concern is it'll just keep coming back if we don't fix the reason that you're getting the pain.
I remember that my husband had new knees, new hips, and when he went for rehab, of course, they told him he ought to take some pain pills first before he goes to rehab because he can do it better. You're not dealing with people who have had hips and knees necessarily. That's the orthopedic world.
Right, but that is within the Sports Medicine Center. So we do have orthopedic surgeons within the Sports Medicine Center, and we have Dr. Chan as our main person who does our hip replacements as well as knee replacements down with our orthopedic group. So the Sports Medicine Center does focus on smaller sports medicine injuries, but also these larger issues of replacements and things like that. We're full service there.
We have Seth Levy is watching you right now, and of course we now can, people, if they have questions, Seth is actually in the healthcare field anyway, so I'm sure he's enjoying your talking with this.
Thank you for tuning in.
And is it unusual to have women physicians in this field?
Women in sports medicine, we are a lower number. If you look at the percentages, we're a little bit higher in non-surgical, but we're still around the 25%, rate in terms of the overall non-surgical field, and then the surgical field, it is much, much smaller.
So. I was wondering about that. So now, are you dealing with football players, baseball players, and tennis players?
Yes.
A lot of sports medicine, right?
Yes, absolutely. So we have our colleges that we cover down there. We are the providers for Broward College, and so we have our athletes with that. I'm the doctor for Miami City Ballet, so I specialize with my dancers and their injuries as well. But then also active people, who are out playing tennis 5 days a week. That's a high level of activity as well, even if you're not a professional athlete.
Oh, I love Miami City Ballet. I remember when they first started, and I was very involved with them. I love their work. They are exquisite.
They do fantastic work. They're a great company, and they really care about the health of their dancers. They are fantastic. There are things that you may not see behind the scenes of how much they not only care for their dancers, how they look on stage and perform, but also their well-being. They're a fantastic company to work with.
Well, this is a question that I have wondered about, and you're a perfect person to answer it. So once someone has been dancing a long time, When do they have to give it up, and do they?
So with dance, especially when you talk about a high
Talk about ballet.
Yeah, professional ballet dancer. Some dancers can dance into their 30s and 40s, but it's rare that they dance at that level kind of beyond their late 40s. And sometimes they transition to continue dancing and continue being active, but just maybe not in the company setting.
And okay.